and look forward to sharing the information today and taking some questions from all of you. Hopefully you can all see our screen and the presentation. I think we can move forward to the next slide. Again, welcome. A couple of things. We are recording this afternoon's webinar. If you're not comfortable with that, just wanted you to know right now so that you can log off and know that we will have a copy of today's recording available at a different time or on our website in the near future. My apologies. We also have American Sign Language interpretation today and transcription and captioning services. If you would like either of those services, you'll see that in our webinar chat. To ask questions this afternoon, we're asking all attendees to use the Q&A feature, which is located at the bottom of your Zoom screen. It should be the third icon from the right, depending on your version of Zoom, but it should be down there with a little Q&A box, and I think we've got a good example of what that looks like there. You want to move to the next slide. Perfect. So again, thank you for joining. I didn't give everyone my name. My name is Becky Carroll, and I am proud to serve here at the Healthcare Authority as the Deputy Division Director for Medicaid Programs. This division oversees the managed care contracts, quality, the contracts themselves, oversight, and compliance. We also have the opportunity to do all quality metrics related to the managed care delivery system here at the Healthcare Authority. In addition, we provide a wide array of community services. One of them we're going to be discussing today, and that is interpreter services. We also have our Medicaid administrative cleaning program and our non-emergency medical transportation, as well as maternal support services. And I could continue to name more, but we have a very dynamic team here at the agency. In addition, Medicaid Programs houses the language access program for the agency, so we'll be covering that today as well. Again, appreciate you all coming, and as you can see, we're going to start off today talking about the language access program. Then we'll move into interpreter services and then have some time for questions and answers. My guess is we won't get to everyone's question today, but we will take them back and get them answered and get back to all of you. Again, welcome. And I'll have the team move the slide ahead one more. And Aranza.
Yes, thank you, Becky. Good afternoon, everybody. My name is Aranza Granrose. My pronouns are she, her, and I am the Language Access Advisor here at the Healthcare Authority. So let me start by saying that the Washington State Healthcare Authority is committed to bridging communications barriers and providing meaningful access to our programs and services to limited English proficient or LEP individuals, and to those who are deaf, deafblind, hard of hearing, and or visually impaired. With that said, let's dive into the Language Access Program. Next slide. Thank you, Jessica. Alrighty, well, the Language Access Program is an internal program that bridges the communication barrier between Healthcare Authority employees and Washington State residents by providing language assistance to clients. This program is committed to help advance equity for the people we serve by providing an opportunity for everyone to receive information about agencies' program, benefits, and services in their preferred spoken, sign, or written languages. This increases their ability to fully understand how our agency can assist them and how to apply and take advantage of the applicable healthcare benefits and services that healthcare authority offers so that they may live the healthiest life possible. Also, we work closely with the Interpreter Services Program team here at the agency, which they will be presenting on their program. This program provides interpreter services to Apple Health Medicaid clients for their healthcare appointments. Again, the language access program here at the agency serves the agency to ensure our clients have access to our programs and services by utilizing the Department of Enterprise Services, or DES, state contracts, and coordinating any requests for providing in-person, over the phone, and video remote interpretation services for meetings, webinars, or customer services without our call center, just to provide just a few examples. We also coordinate requests for written word translation services like agency forms, publications, letters, annual forms, and other publications for the Medicaid program. It is healthcare authority practice to proactively translate these vital written documents in a way that reflects the statewide population demographics and or the frequently encountered languages of individuals eligible to be served or likely to be affected by the benefit program or service. We also work with the Washington State School for the Blind for Braille translation. And we also utilize the DS, a statewide contract for transcriptions and captioning services for agency meetings and webinars. Next slide, please. Thank you, Jessica. So keeping in mind that our program's goal is to continuously improve access to healthcare authority programs and services, here are some examples and some things that we're currently working on, and I would like to share with you. One, evaluate data on preferred languages and utilization of language access services to track and monitor effectiveness and identify areas for improvements. Two, provide training to our agency staff on cultural competency, language access regulation, and best practices for best serving the limited English proficient or LEP individuals and those who are deaf, deafblind, hard of hearing, and or visually impaired. Three, collaborate with other agencies and other organizations to share resources and best practices in advancing language access. Four, continue to enhance accessibility through innovation and technology integrations to facilitate access to services like, for example, a multilingual public-facing website. And five, evaluate and update language access initiatives based on feedback, emerging needs, or demographics to ensure ongoing improvements to the needs of this population regarding language access. All right, here are some resources that may be helpful to you. The first bullet displays the Healthcare Authority Language Access webpage. This page provides information on who to contact and how to access interpreter and translation services when working with the Healthcare Authority. The second bullet displays how to find translated materials and information about Apple Health coverage. Language assistance services are available to Apple Health clients free of charge and include direct services by bilingual employees, interpreter services, and translations of printed materials. To learn more, you can download our flyer on how to access language assistance, and also available in the languages showing in this slide. And I will be posting all of these links in the chat so you can actually access to them, to this information. And the third and last bullet is if you see materials in the language that you don't see the materials, right, that in a language that you need, just call the Healthcare Authority at 1-800-562 3022 and request those materials in the language that you need. So we do strive to improve and advance language access because it is not just a necessity, but a priority in our pursuit of health equity. And our agency is committed to this effort. Now, the interpreter services team will be presenting. Joanna, just take it away. Thank you all.
Thank you, Aranza.
Joanna, thank you for all your efforts to put together the presentation this afternoon, as well as Jen Price. I think before we get started, I do just want to make a notation that our language access program, or I'm sorry, that our interpreter services program that we're going to discuss next was developed and funded to support the federally subsidized Medicaid program. The program's foundation itself does not allow for it to be leveraged for the Apple Health expansion population. And in order to ensure accessibility for Apple Health expansion enrollees, we have contracted with the health plans or managed care organizations to provide these services. Apple Health Expansion is a general fund state program that will provide integrated managed care coverage to individuals who are uninsured and ineligible for federally subsidized health care. So just noting that I know that has been something that the agency's been talking about a lot lately. This particular webinar is specific to our language access program internally, as Aranza just covered, and then the Healthcare Authority's Interpreter Services Program. If you have questions about Apple Health Expansion, we will put the email address in the chat, and also some very informative web pages. Joanna, Jen, please go ahead.
Thank you, Becky. Good afternoon. Like Becky said, my name is Joanna Gaffney, and I am the Interpreter Services Operations and Data Utilization Specialist. I'm going to share some information with you today about our program. Like we discussed before, if you have questions during the presentation, please go ahead and put them in the QA, and let's get started. So
Hi, Joanna. Just a quick interruption. Apologies for this,
yeah.
but you're in presenter view, so everybody can't see the slides at the large way.
Oh, okay. Let's see. Let me see if I can fix that. Thank you. How about that?
Looks good. Thank you.
Thank you so much. All right. HCA's Interpreter Services Program is a cost savings program for Medicaid providers. We give Medicaid providers a way to schedule free interpreting for Apple Health clients with easy access to online request platforms. We provide access to sign language and spoken language interpreters that can facilitate effective communication between healthcare providers and clients, which assists the providers in fulfilling their federal obligation to offer language assistance to individuals who have limited English proficient and other communication needs at no cost to them. Our program helps the client and the provider to have more effective appointments by reducing language barriers, which leads to more equitable healthcare services that create healthier outcomes. Since this program is a provider-based cost savings program, there are specific requirements that must be met in order for a request to be accepted. The healthcare provider must be an active Medicaid provider. The ability to secure an interpreter for any given client depends on the client being enrolled in allowable Medicaid programs. We do have a specific program billing guide. If you want more details, you can take a look at that, and we'll drop that in the chat for you before we end today. The appointment must be a pre-scheduled appointment with a healthcare provider. Examples of this could be a physical medicine appointment, behavioral health, dental, or a substance use support appointment. Provider responsibilities. Healthcare providers are federally required by the Civil Rights Act and the Americans with Disabilities Act to provide interpreters for their limited English proficient clients and deaf, deafblind, and hard of hearing clients. This means if a healthcare provider does not provide interpreting for clients, they are federally out of compliance. HCA Interpreter Services Program supports this effort by offering interpreter services through Universal Language Service and the statewide contracts managed by the Office of Deaf and Hard of Hearing. To find out more about client rights or to file a grievance, please see HCA's Interpreter Services client page. We have two separate dashboards, one for spoken language and one for sign language. Both dashboards are compatible with Spectrum, which supports visual accessibility to the dashboard features. It is important to note that the data points measured and the terms and definitions on each dashboard are different. We will walk through these differences later in the slides. We also want to highlight HCA's obligation to privacy. Dashboards suppress data in several ways, and suppressed data is represented by 3 asterisks. Spoken language data is suppressed when the number is less than 50, while sign language data is suppressed when the number is less than 11. Sign language data dashboards. HCA accesses the Department of Enterprise Services, or DES, statewide contracts for sign language referral agencies and independent contractors. These contracts are managed by the DSHS Office of Deaf and Hard of Hearing, or ODHH. These contracts do provide scheduling and referral support and assist interpreters and providers in the scheduling process. Data is provided from ODHH monthly. It is obtained through the ODHH online request form. The data is displayed in 2 ways on our dashboard, 1 by metrics and 2 via a map. And the data that is available is from March 2021 to the current last full month. In 2020, HCA worked with federal partners to develop appropriate definitions that would accurately represent how to measure the state of a sign language interpreter request. These definitions differ from our spoken language request and were determined the most accurate reflection of the interpreting work. We measure the rates based on the accountable communities of health boundaries, as well as providing statewide rates. Completed appointment is a request that has been filled by an interpreter, and the appointment was completed with the client and the provider. A fulfilled rate measures the percentage of total service requests where an interpreter was assigned when compared to the total services requested. Our language dashboard, our sign language dashboard design has been under construction to make it more accessible. One of those accessibility features is to update from small arrows at the bottom of the screen to change the report pages to larger tabs across the top of the screen that will be screen reader accessible. To change the date on the dashboard, select the End Date box under Dates, then select Desired Month, the last day of the month, and the year from the pop-out calendar. You will then select the start date from the first box, select the month, the first day of the month, and the year from the pop-out calendar. Note, if the data does not seem to move, confirm that the end date is after the start date. So let's do an exercise and review the dashboard to find out how many requests were received from April 2023 to April 2024 in the Greater Columbia ACH. We will look at what the fulfillment rate is for that time period, the service type that was most common, and what contractor fulfilled the majority of the requests for that ACH during that time. So here's what our metric data page looks like. You can see here is the date range filter. We have it set on April 1st, 2023 to April 30th, 2024. We can see that the overall fulfillment rate for that time period was 91%. Now remember, the fulfillment rate for sign language is the percentage of total service requests where an interpreter was assigned when compared to the total services requested. We can see the total number of service requests for that time period was 910. The fulfillment rate by ACH down in the right corner here is where you can see that Greater Columbia is highlighted. You can look for data for a specific ACH by selecting that line. We can see the most common service type here and which DES ODHH statewide contractor filled the most jobs. In this case, ICSH stands for Independent Contractor, Shelley Hansen. If you follow me up here to the top left, you will see a question mark icon. Select this for dashboard instructions. And just below that is a lowercase letter I with a circle. If you select that icon, report information will pop out. It is important to note that the data is always being updated, so the data on the dashboard does change as the data set matures. Now, onto our spoken language dashboard. Data is provided monthly from our coordinating entity, Universal Language Service. As the coordinating entity, Universal provides an online scheduling and payment software platform that coordinates requests between Medicaid providers and interpreters. HCA receives monthly data from this platform. It's important to note that Universal is not a referral agency and does not assign interpreters to appointments or manage their schedules. The interpreters are independent contractors or freelance contractors and choose when and where they prefer to work. The data dashboard includes in-person data from 3 state agencies, HCA, DSHS, and DCYF. These 2 partner agencies access HCA's in-person coordinating entity contract for some of their work. Over the phone and video remote data is only from HCA. The dashboard changes as the data matures, and it includes data from the most current 2-year span. HCA is subject to the Language Access Provider Collective Bargaining Agreement, which stipulates the payment terms and other conditions that the state or contracted coordinating entities must comply with. It is important to note that HCA is only permitted to provide an interpreter who is part of the union. These interpreters are called Language Access Providers, or LAPs. The definitions for the completed and fill rates were developed in a collaboration with the Interpreters United Union. At that time, HCA had the only coordinating entity contract and only in-person services were available. The contract fill rate is measuring whether an interpreter accepted and was assigned to the request at any point during the life cycle of the request. This rate is intended to measure whether there is a sufficient pool of LAPs available. It is not measuring whether the appointment actually occurred or if an LAP provided a service. The completed rate is measuring whether an LAP accepted an appointment and that appointment actually occurred and the LAP and provider showed up and provided services. These rates are measuring 2 very different things. And it is important to know that LAPs are not required to complete an appointment they have filled. They can give back that appointment at any time. When this happens, the request goes back into the platform and becomes available for other LAPs to accept and fill. This dashboard was built many years ago and uses an older version of the Power BI software. It does look and feel a little different than the sign language dashboard. There are 7 pages of the spoken language Power BI report. To move the report from page to page, select forward or backward arrows at the bottom of the page. Or you can select one of the page numbers. This will allow you to select a report page from a pop-up menu. This menu displays each page's name. To change the date range, select the end date from the second box under dates, then the month, the last day of the month, and the year desired, and then move to the start date, which is the first box, select the month, the first day of the month, and the year desired from the pop-out calendar. On any of the report pages, you can also filter the report by category, language, job county, program, or service type. Select the down arrow for the criteria field you want to filter. Select the checkbox that appears to the left of the item you want. Power BI will automatically update the report based on your selection. Power BI dashboard training is available to learn more about navigating the dashboard. The first metric page of our spoken language dashboard. Here's where you will find some of the features we discussed in the previous slides. Date range filter, category and language filter, job, county, and program. The program is where you can see the data is from the different agencies, HCA, DSHS, or DCYF. Service type, this would be the in-person, the over-the-phone pre-scheduled, or the video remote pre-scheduled. You can also see down here a call out to the suppressed numbers at the bottom. And last, our overall fill rate. Remember, the fill rate for spoken is measuring whether an interpreter accepted and was assigned to the request. The top 7 languages were determined based on utilization through the prior coordinating entity and were part of the competitive procurement process. All other language falls into the HD/LD category. HD means high demand and LD means low diffusion. Please visit our data dashboard webpage for our spoken language dashboard fact sheet, along with other information about this data. Let's do another exercise. Review the dashboard to find out about video remote requests from January 2023 to March of 2024. We'll look at how many requests occurred during that time, what the statewide fill rate was during that range, and what was the fill rate percent for Arabic during that time. So as you can see, we selected the video pre-scheduled filter. Total requests occurred for this time period was 16,970. We can also see the statewide fill rate during this time was 88%. And if we go over here to the fill rate by language, we can see the fill rate for Arabic for this time period was 93%. On the next page, we'll review the dashboard to understand how to find completion rates. Information for VRI requests from January 2023 to 2024. What is the statewide completion rate? What is the completion rate for Farsi? And what language has the highest completion rate for that period? Reminder that the completion rate measures whether an interpreter filled a request and if the appointment was completed with the client and the provider. LAPs can be paid for appointments that were not actually completed. For example, if the client no-shows or if the appointment was canceled last minute, these types of requests are counted in the contract fill rate because an interpreter was assigned at one point in the lifespan of the request, but were not actually resulting in a healthcare appointment. The completion rate only measures requests where an interpreter was assigned and the client appointment occurred. The completion rate does not include the requests where an interpreter was paid, but which did not result in appointment, such as last-minute cancellations. So on this report, you can see we have filtered to the video pre-scheduled. The statewide completion rate is 63% for that time period. The completion rate for Farsi for this time period is 54%. And we can see Spanish has the highest completion rate at 69%. This tells us that the number of interpreter requests that result in an actual appointment is much lower than the contract fill rate. Returned and unfilled. This metric measures how many filled requests were returned and were never refilled, meaning how many filled requests that did not have an interpreter assigned for the date of service. Remember, a request is considered filled if an interpreter accepted the job at any time during the life cycle of the request. We wanted to know how many requests were given back by an interpreter and were never refilled. This would not be considered an unfilled request because the interpreter was assigned at one point. However, this would be a request that was not completed. On the next page, we'll review returned and unfilled VRI requests for March 2023 through March 2024. How many requests were returned by interpreter during that year? What is the statewide returned and unfilled rate for that time frame? What language has the highest rate of return and unfilled requests for that year? And what is the fill rate and the return rate for Pashto? So here we've selected video pre-scheduled, our date span, the total amount of requests returned by interpreters for this time period was 117. The statewide returned and unfilled rate for this time period was 1%. If you look over in the rates by language, we can see Nepali had the highest rate of return and unfilled requests at 38%. And if we skim a little further down, we can see the fill rate and the returned and unfilled rate for Pashto. 19% fill rate and 6% return unfilled. What this tells us is that most of the video remote filled requests that get returned do end up as a completed request. There are very few requests that are returned and never get refilled by another interpreter. As we conclude our presentation, we wanted to call out some of the language access related engagements the ISP is involved in. Our program has a strong relationship with ODHH, and we partner closely with them on various projects, including their expos and their interpreter shortage work group. We also collaborate on contract changes, and ODHH seeks HCA's involvement on program changes regularly. We participate in many statewide work groups, including the DES Language Access Community of Practice and Purchasers meetings, and the DSHS LTC Advisory Committee. We also regularly participate in advocacy work groups such as WASCLA. We are asked to attend various events to provide presentations about our program, and we also provide training and overview presentations for facilities and clinics upon request. HCA is heavily involved in the bargaining efforts for the Interpreters United Union and has been the primary agency participating in the collective bargaining and related programmatic outcomes. We work closely with our partner agencies in this effort, including DSHS and DCYF. Our team has a strong role in supporting and promoting accessibility and participates in a wide range of agency operations to include web accessibility projects, updates of Provider One to improve screen reader accessibility, providing guidance on appropriate methods for requesting sign language interpreters for HCA business needs, and participating in access to care grievances. Our program helps Medicaid providers meet their obligation to appropriate language access services. And our team is dedicated to finding ways to improve the program and improve access for clients. We are always interested in getting the word out about the program and participating in outreach efforts. We invite you to reach out to our interpreter services inbox with any suggestions. Thank you for joining me today. We will make sure we have all the below resources linked in the chat. Our program supervisor, Jennifer Price, has also joined this webinar today to help answer any questions about the program that may have come in. I will hand it back to you, Becky.
Thank you, Joanna. I really appreciate that. And Jen as well. Thank you for participating today. It is nice to get an overview of the work that we're doing here at the Healthcare Authority. Just wanted to note, we have some chat or some questions and answers already being generated in the Q&A. So if you have not seen those, again, navigate to the bottom of your screen in Zoom and you'll see a Q&A kind of bubble there, and we will do our best to answer the questions we can in real time. I did receive one from Nedra. Will you be talking about how internal healthcare authority program, so our language access program, will serve or is serving all clients, regardless of whether they are in an Apple Health, a current Apple Health program, or the future Apple Health expansion program? Nedra, I really do appreciate that question. I will say that our language access program serves all lines of business for the Healthcare Authority. And our commitment for health equity, accessibility is at the core. And so we do provide language access services for not just the Medicaid program, but for our public employee and school employee benefits boards, regardless of how an individual may be enrolled into a plan or program here at the Healthcare Authority. All of the Healthcare Authority employees have access to language access services for webinars like this, for interactions with clients or with stakeholders. Aranza, anything else that you would add there?
No, I think you really, cover it all. Thank you, Becky.
Yeah, no problem. So I will open the floor up here. If you have a question, please put it in the Q&A function here in Zoom. You can navigate, again, like I said, to the bottom of your screen and hover there. You'll see a Q&A bubble with a little question mark in it, hopefully, and we will take your question. Jen and Joanna, anything that you would add from the questions you've added or you've answered in the chat for the larger group?
Hi, thanks. No, I think that if there are any questions about how the Medicaid Interpreter Services Program operates, there's lots of information in the chat. Just reach out. Tons of resources to help. If you know of any provider offices who are struggling to meet their requirements, we always are looking for help in spreading the word about the program, so share it widely. And just to recognize, there is a major interpreter shortage for all languages, spoken and signed. It's a huge problem just across the nation. And that does pose challenges. It's something that many agencies are talking about right now, which you heard Joanna mention earlier. One of the projects we're working on in partnership with the Office of Deaf and Hard of Hearing is regarding their interpreter shortage project that they have. So we know that that's a challenge. And in our spoken language arena, we provide a software product that helps coordinate requests. We don't get to actually dictate what an interpreter does or does not do. So that adds a little bit of extra layers there. But we do work regularly, constantly, consistently with anybody who has information to share, opportunities to help us encourage language access providers to accept that work. But we do recognize it's a challenge. So again, if you have any recommendations, suggestions, any resources, we're open here. We want to always improve, continuously strive to do so. So please reach out. Our contact information is in the chat.
Thanks, Jen. Appreciate that. Nedra, I see you had a follow-up question, or an additional question rather. Will there be a dashboard for Apple Health expansion interpreter services provided by managed care organizations? The agency will begin to collect data from the managed care organization. I think our intention will be to share that I'm not sure if that will look like a dashboard, similar to one that Jen and Joanna manage and presented on today. But certainly that is something that we are looking into. Uh, Again, the program will begin on July 1st. And so we are still working with our managed care organizations on what data metrics they have from their contractors and what we could, what we're requiring for reporting purposes. And so more to come on that. Aranza, I see one in the chat. Are document translation services available to providers? Thinking about documents provided to clients. Uh, so I would note that if a client indicates a language other than English that they need translation or documents translated into, and they are generated here by the healthcare authority, that we do accommodate those requests. We also do the same, we do require the same from our managed care organizations, regardless if it is the Apple Health integrated managed care, integrated foster care, wraparound contract, or starting July 1st, Apple Health expansion. Aranza, would you add anything else there?
Yeah, just that documentation provided to clients if there's, like you mentioned, we definitely work with to make sure that clients are receiving the information in their preferred language. So we encourage always to reach out to us so we can fulfill that request. So yeah.
I think to be very succinct too, I know that you're asking if it's available to providers. This is not a service that we provide today to our provider, to provider and providers who are enrolled in Medicaid. And to my knowledge, providers are public employee or school employee, but I don't know that for sure. I just know we don't do that for Medicaid.
For the providers, yeah.
Yeah, Medicaid providers, correct.
We do have resources, though, that they are, Apple Health resources on how to apply and things like that, where we have in different languages, so as resources. So
we do have a request for the presentation, and I think we had planned on posting the presentation around. Is that correct?
we can share. We can definitely share the presentation. And we can post it probably in our external site.
Yeah, the language, I would think.
We can actually send a golf delivery when it's posted.
Melina asks if the managed care organization interpreter services are paid with public funds, and are those patients covered by Medicaid? So the managed care organizations have been asked for Apple Health expansion to oversee an interpreter services program. Those funds are general fund state funds. So yes, they are public funds. These patients are not eligible. Those who are enrolling in Apple Health expansion are not eligible for federally subsidized Medicaid services. There will be a few that we will be able to answer maybe live. Just taking a quick peek here. We're doing our best to make sure we're answering questions. Taking a look here, it looks like we are answering a couple of questions in the Q&A function of Zoom. But we'll hold on here if you have other questions for us. I will note in the Q&A, there's some information about WASCLA update calls. A couple of questions about the dashboard and the fill rates that Joanna and Jennifer covered. A note that at this point, our interpreter services program at this time cannot provide on-demand services. Linda, thank you for your follow-up question. Our language access service is not provided or available to providers. That's a internal program to support healthcare authorities' interaction with its clients. Jen and Joanna, I'm noting that Michi has a question in the chat around how individuals might be able to share feedback about their interpreters. I don't know if there's a link or a way to do that. I think there is, Jen, if you want to share that with the group. Yeah.
Absolutely. Well, it depends on what contract you're accessing the interpreter through. So if this is a spoken language interpreter that is obtained through our coordinating entity, then you can submit feedback directly through that platform. There is a fairly robust feedback process, which is we coordinate with the union on that. So we get their buy-in and feedback on that. So if you have feedback that you would like to provide, whether it's good or bad, kudos are always welcome as well. That is provided directly through the scheduling platform. If it is for sign language, then that would be coordinated directly through the DES statewide contracts and also through the Office of Deaf and Hard of Hearing. They are always willing to accept that information. If you have trouble submitting any of that feedback, you can just contact us and we'll help guide you and get you to the right place. So that would be our interpreter services inbox, which we'll make sure is reposted in the chat.
Great. We'll give it another couple of moments. If you have any last minute questions. Again, we really do appreciate you all taking some time out of your day to join us for this presentation. We'll be sure to, I think, send a Gov delivery message out when we post the presentation for folks. And there are links to our website for Apple Health expansion, an email address if you have any additional questions about that, and an email address for our interpreter services program as well in the chat function here in Zoom. So that is just the little spoken word bubble at the bottom of your screen. Copy is not working. Oh no. That's unfortunate, Nedra. I did not realize the copy function is not working from chat. We'll make sure that we provide the links, I think, on the resource page of the slide deck. Thanks for letting us know. Right. With that, I think we'll end our webinar today. And again, thank you all for joining. If you have any questions and follow up, again, our email address is in the chat. My apologies that you've got to type that out, but we will follow up with the slides in the next couple of weeks. We really appreciate your time and your energy today. Thank you.